Administrator at the Jackson County Medical Care Facility, Destiny Wilkins. Destiny, welcome back to the show.
Hi, well, thank you so much for having me, Bart. I really appreciate it.
Yeah, great to see you. You know, we lost, I think, touch with a lot of people. I think everybody did during the pandemic, and like like all healthcare facilities, you just couldn't go. It was a rough time. How did you guys make it through the pandemic?
Well, I'd like to be able to say that we came out unscathed, but you know, just like every other healthcare facility, we definitely faced our challenges. And I think every healthcare worker that worked through this pandemic definitely came out with some sense of trauma of the impact that this has had on the nation and on our residents. But we were very fortunate to be very successful to keep COVID out of Jackson County Medical Care until November of 2020, which was really quite an amazing feat for our care partners that were with us during that time, and the work that they did at home to keep our residents safe as well. So.
Awesome. Yeah, you're right. The medical care workers are, I think we all consider them heroes and frontliners, and it was tough. And I think a lot just left the profession.
Yeah. The American Healthcare Association is reporting that based on the number of people that have left the healthcare field, that it could take up until 2026 to actually see the healthcare workforce regain where it was. So, but we're working really hard on that here at JCMCF to rebound and to get back to what it felt like before COVID.
Good.
So.
Well, that's for those not familiar with Jackson County Medical Care Facility. Maybe we can get some thumbnail sketch of what you guys do and who you are, who you're for.
Well, we've actually been in the community for a very long time. So we've actually been operating since the 1800s in various ways. So the Jackson County Medical Care Facility, before it was a medical care facility, was actually the county poor farm and served those that were medically indigent and didn't have the ability to care for themselves way back into, I think it was the 1850s. So it's really amazing to see that that love for community continue on through all of these years. So now our focus is really on caring for both short-term residents that are looking for some rehab. Maybe they've had some surgery and they need to do some recovery to get some strengthening. And then also for those that maybe just can't live at home any longer and need 24-hour nursing care. And so we care for folks that have dementia. We have many residents that just physically their bodies aren't able to keep up with where they'd like to be anymore, and they need that support. And so we're able to provide them with that care.
Yeah, I know you've got really quite a variety, but you do have a lot of long-term residents who provide, you get a sense of community for those that live there long term.
Yes, and we have a wonderful activities director that puts together a lot of great opportunities for our residents to continue to find joy and ways to even give back into the community or give back to the care partners that work at the facility. And so that really has helped us even through COVID with the resilience that we had, because we all had a sense of purpose. So.
Yeah, and I know you all have a sense of pride too, because you have recently been honored with a number of awards, including the Bronze National Quality Award.
Yes.
Congratulations.
Thank you. We are so excited about this. So the American Healthcare Association has a quality award program, and you have to start at bronze. And you apply and you provide them details about the work that you're doing around improving quality in your home and making sure that you have processes in place to be able to build that quality over time. And they have a set of examiners that look at that criteria and see if you meet that criteria. And we did this year. And so we're very excited about that. And hoping that we're going to be able to continue that journey forward to their next levels, their silver and gold levels in the next couple years.
Well, let's hope. This year bronze, next year silver, and then gold.
Yeah, that's what we're hoping for.
Well, your industry really is, it is under a lot of scrutiny by regulators and evaluators. You do have to meet certain standards, and they're in there all the time, aren't they?
They do come quite frequently.
But you also have independent reviews and reports about what you guys do, including, I know Newsweek takes a look at facilities, and they thought highly of you.
Yeah, so Newsweek magazine actually puts out a list of the top 400 nursing homes in the United States every year. And so for the last 3 years, we have been featured in their top 10, which has been so exciting to see. And amazing to see that throughout, even with everything we were dealing with COVID, that we were still doing care the right way. And being honored on a national level for that. So that's really exciting for us.
That's awesome. And the federal government, too.
Right, yeah. And so the Center for Medicare and Medicare Services, or Medicare and Medicaid Services, it's a mouthful, or CMS, they have a system called the Nursing Home Compare website. And so they rate all of the nursing homes in the nation based on different criteria. And your goal is to be able to be a 5-star facility, and we are a 5-star facility.
5-star, that's as good as you can get.
Yeah,
That's
so
awesome.
we're very excited about that. 5 stars overall, and 5 stars in our staffing component, which we were talking about with healthcare workforce, that's a big deal.
That is, yeah, it really is. That's great.
Yeah.
Now, I know one of the things you weren't able to welcome in were volunteers, and you had to limit outside activities. Are we back now? Do you have a volunteer opportunities at JCMCF?
We do have volunteer opportunities. Things got a little bit narrowed down during that COVID time, and even with some of the requirements around vaccination, and some of those have lifted. So we are able to take volunteers on, and we're looking for actually some volunteers to help us with taking residents back and forth to the fair. So if that's something people are interested in, would love to have them reach out to our activities director, Michelle, and she would be able to get them hooked up with those opportunities.
Yeah, I know you do. There's a lot of things you do and have done in the past, like trips to the casino, and as you said, the fair.
And those are back on now, and very popular.
Very popular.
Very popular. We have some really lucky folks in our facility.
They win?
Yeah, better than I do.
What about the 4th of July holiday? Will there be hot dogs and baked beans and potato salad on the menu at all?
Oh, I'm sure that there will. We always love a good cookout, so maybe not outside this year with all of the air quality things.
It's
but
the water, it's the air quality,
right?
Yeah.
Well, if we've made it through the last 3 years, we can make it through anything.
Bring it on. What
right?
else you got?
I'm scared to say that.
Yeah. But you've got room there. There is room for new patients, new residents.
Yes.
New rehab.
Yeah. And our rehab area, we had actually renovated that in 2019 before COVID, and didn't have much of an opportunity to use it for that. But we have some really wonderful private rooms in that area, with some nice state-of-the-art technology with lifts in our ceilings for those that need assistance with mechanical lifts. And it's right close to our therapy department, which was all renovated just before COVID as well. So we do have some opportunities available if there's somebody that needs that care.
Yeah, and that's amazing and critical, because it's not something that's everywhere. The lifts built into the rooms and necessary for a lot of your patients.
Yeah.
Well, we congratulate you and your staff for all the honors. I know it's a result of a lot of hard work, and we appreciate the care you provide our community.
Well, thank you so much for having us on, and we do have an incredible team, so it's great to be able to share that with the community, because we're not always great at tooting our own horn over here. So,
well, I'm glad you were able to come in today, and there's always, as Destiny said, opportunities for volunteering, and there's also openings, so visit their website. Jackson County Medical Care Facility Administrator Destiny Wilkins.